At Rocksteady Boxing, our goal is to provide interest and motivation to fight back against Parkinson's while maintaining safety and minimizing risk to the individuals participating in our program. At Rocksteady headquarters, we understand the value and legal accountability of using an initial evaluation or assessment process when bringing in a new member who has Parkinson's. Typically, a new member will call or walk into your facility inquiring to join your program. It is recommended to do an over-the-phone or in-person short interview to determine interest in the program. Whether you're talking to the individual or the care partner, some recommended questions are: how long have you been diagnosed with Parkinson's? What is your age? Do you use an assisted walking device? Are you currently physically active? This is also the perfect opportunity to do a little detective work. Remember, you are on a fact-finding mission. Ask questions like, are you still able to drive? Do you have a support system? What is the distance from your home to our RSB program? Have you had any recent falls? If you're able to talk to a family member or care partner, you may also want to ask, does your loved one have any additional physical or cognitive challenges? If at all possible, schedule the individual or family to observe a class. Previous questions should assist coaches in determining the proper class to observe if your program offers various levels. The day of the assessment. When the new member comes in for the initial assessment, make sure to greet him or her with a smile. Often, it has taken a great deal of courage to show up for this moment. Some new members come full of energy, hopeful, and ready to go, but others may be in a totally different state of mind, depressed, anxious, and in despair. The bottom line is, be ready for just about anything at that first meeting. We recommend sitting somewhere quietly where you can talk and minimize distractions. The time you spend in those first few minutes might be the most important part of the assessment. This is the beginning of what will probably be a very long relationship. In many ways, the boxer, their families, and the coaches become a lot like family. It is helpful to have a new member packet prepared and ready prior to the assessment. Your new member packet might include the following: new member information form, pre-participation tool like the PAR-Q, ACSM, etc., a doctor's clearance and/or release, in case of emergency or ICE form, waiver of liability. Remember, state laws on waivers may vary. The Fullerton Dynamic Balance Test, or FAB, for members not at a high fall risk, or the Berg Static Balance Test for members who may be a fall risk, an assessment score sheet. Please see examples of all of these forms in your coach's management system. Some additional forms to consider might be business cards, schedule of classes, a cornerman pre-participation form and waiver, a directory of resources, such as support groups, local movement disorder specialists, or other activities Parkinson's-related near your facility. This initial conversation is a good time to help ease fears by explaining how important it is that they made the decision to join Rocksteady. Try and help them feel like they're in good hands by explaining that the methods used by Rocksteady have been proven through research to improve the symptoms of Parkinson's disease. Not only the physical symptoms, but it is a place for emotional support through friendships and camaraderie. Occasionally, somebody may have a hard time filling out the paperwork for various reasons. In that situation, we would offer to assist them, or if present, ask a support person to help them fill out their paperwork. Once the potential member has finished filling out paperwork, it's time to sit down with the member again and really get to know them. Look at the paperwork. Important considerations for the assessor are: is the handwriting legible, especially important for contact and emergency contact information? Is the emergency contact person local? Ask about the day of diagnosis. Ask about previous occupation. Are they retired? Is their care partner retired? Ask about hobbies and interests. Medical information. Obtain the contact information for their general practitioner or neurologist. We try to ask which physician knows that member's health history best, and often it is the general practitioner or internist that knows them well. Did they check any medical conditions of the pre-participation form? If so, discuss. If they checked medical conditions that put that member in a high-risk category, discuss in detail and record on the paperwork provided. If the individual is at high risk for medical conditions, obtain medical releases and medical clearance forms from any physician related to these high-risk categories. If the new member is complaining of an undiagnosed pain or injury, it is important to stay within your scope of practice and refer that member to a trusted clinician, such as a physical therapist, occupational therapist, or even a movement disorder specialist before proceeding with the physical portion of the assessment. Case study. John Smith completed his pre-participation form and indicated that he has recently had heart valve surgery and is on blood thinners. He has also indicated that he has a fusion in his low back from 2 years ago. In this situation, it is highly advised by Rocksteady headquarters that the assessor obtain a medical release and/or clearance form for both his cardiologist and orthopedic surgeon. We would advise, if a client presents with multiple high-risk categories, to wait to do the assessment until all of these releases are obtained and the physician has cleared him or her for physical activity. These precautions cannot be stressed enough to protect both the new member and the affiliate location where the assessment is being performed. We make every effort to have both a medical release and doctor's clearance in every member's file. We suggest to offer to fax both the medical release and doctor's clearance to the member's physicians. It has been our experience that this can help expedite the process. ICE form. The ICE form is a document that provides pertinent information in case the member has an emergency. During the unfortunate rare occasion where emergency personnel have been called, it is important to grab this ICE form from the member's file to hand to the emergency team treating that patient. Once you feel you have covered reviewing the paperwork with the new member, transition into the physical assessment process. Some new members may have anxiety that the physical test may be rigorous and difficult, but explain that these are meant to gather important baseline information in order to properly place and prescribe proper exercise for that individual. At Rocksteady headquarters, we have used various assessment tools throughout the years, but currently use these four as the baseline for our initial assessment: the Fullerton Balance Test, or FAB, the Berg Balance Test, the Timed Up and Go, or TUG test, the 30-second sit-to-stand test. All four of these tests have a full-length video in the coach's management system that shows what equipment is needed, demonstrates how to do the test, and offers safety tips for a successful assessment. In addition, to ensure safety, a second assessor or cornerman is recommended to guard the new member during the assessment test to ensure safety. A gait belt is recommended if the new member has indicated a history of falls on the new member questionnaire or appears to require assistance or have postural instability. If someone has been determined to be a high fall risk, are unable to stand or bear weight on their legs, and are confined to a wheelchair or seated walker, we may completely bypass the physical portion of this assessment. Use safety first. If there is ever a test that seems too stressful or difficult, skip it. Remember and explain that the initial assessment is only a baseline, a tool for the coaches to observe the individual, gather both subjective and objective data, and most importantly, get to know that member. After the assessment, it's time to explain which class you think that member should attend. It is always a good idea to place the new member conservatively in a class that allows for improvement and does not overwhelm or underwhelm the individual. Discuss the schedule, payment options, and paperwork, and go over the equipment that they may need. Because initial intake and assessments are an investment in time and require qualified personnel to administer, many Rocksteady affiliates charge a fee for initial assessments. Whether or not to charge or how much to charge is up to the individual affiliate team and location. Many affiliates offer equipment packages to new members that provide everything they need to get started. Having some new boxing gear, merchandise, and some skin in the game can boost their confidence, increase the likelihood that they will return, and be a good, positive topic of conversation for new members and their friends and family. Answer any questions they may have, offer them a hug, and welcome them to the Rocksteady family. After the assessment, it is a good idea to privately email the rest of your staff or coaches the necessary information on your new member, particularly medical information that may require special attention or modifications in class. It is also a nice gesture after the assessment to send an email or handwritten card to the family, welcoming them to the program and reminding them to reach out if they have any questions or concerns. And as always, please feel free to share your own tips and other tests that you might be using that you found helpful in your own programs with your fellow RSB coaches in the Rocksteady Coaches community.